What do you think about constipation management in your practice?
When patient says constipation, I very clearly ask him that whether there is a lack of generation of your intestinal pressure to urge to defecate, or do you have a feeling of incomplete evacuation? With these patients, what I have seen in my clinic is that the incomplete evacuation is more common than the actual constipation. So the actual constipation is defined in 3 ways. The slow transit constipation, where there is no urge for days. The normal transit constipation, which is classically IBS, which is these people,
Correct.
feeling of incomplete evacuation, and pelvic dysynergia, where your where the rectum and the anal canal do not align, and maybe you are straining against a closed anal sphincter. So, and you have to insert your finger. So this becomes a very common thing. We have to ask them, do you insert your finger in your anus to remove stools? So that becomes a classical solitary rectal ulcer syndrome kind of picture. So these people are classically having feeling of incomplete evacuation. So again, what we have seen in the last 40-50 years is so I don't know about this part of the country because very less exposed to the south of India. But in north, there was a concept of taking you understand lota?
What is lota?
Lota is a mug
Mug,
of water.
okay.
It's to mug of water and go to the farms to defecate in the open.
Yes.
So that was the Indian style of defecation. Right? So the Indian style was always squatting.
Correct.
So squatting actually makes your recto-anal angle aligned. So the straining becomes less and you are not straining against an acute angle. So the recto-anal angle becomes straight on squatting. So with from those farms to our very classical Western toilets, the squatting position, the Indian position has gone. So that is also a very common thing which we have seen. So we counsel our patients to put stool
Correct.
beneath their legs so that at least it becomes semi-squatting.
Correct.
So it aligns the rectum and the anus.
Right.
So that it's easier for you to strain.
So the stool just gets aligned with the toilet bowl.
Yeah, you
At
can
the
just
bottom.
semi-stool. So it's
Yeah.
semi-squatting at least.
Okay.
So because today it's tough to find Indian style washrooms, so it's difficult to
Yes.
squat.
Yeah.
So but squatting is a very important position for constipation patients, which we have lost with time.
Right. I think in US we do something called squatty potty.
Okay.
Okay, it's a small stool that goes right at the base of the toilet bowl.
Okay.
And then you try to maintain that angle what you're talking about.
Okay. So not aware about it in India, but we do it the Indian way.
Yeah.
So we ask them to put a stool.
Stool, okay.
So that's one. Second, what we have seen is the advent of processed foods and the decrease of fiber. So 40-50 years ago, we were predominantly a fiber eating country. Right? It has gone down with millennials and further with Gen Zs. So these ultra processed foods of pizzas and the increase of maida as a delicacy, the refined flour. So, and the fiber going down. 70% of Indian population today is fiber deficient. So fiber does a very important job in particularly the insoluble fiber, in cleaning your large intestine like a broom. We call it a jhadu like, and it pulls water and makes stool soft. So fiber becomes a problem. So immediately adding a lot of fiber is a problem. So graded increase in fiber intake is very important in these patients. And that becomes very, very important. So 2 things are very important here when we manage our constipation patients. Third, we have to ask them not to keep straining, not take cell phones, newspapers to the washroom because they want to make their toilet time productive. They call it me time,
Right.
but they keep straining. And when they keep straining, very commonly these patients start bleeding. Because they are the normal veins around the anal area,
Correct.
which get swollen, and we call them hemorrhoids or piles. In Hindi, we call them bawasir. So a lot of these patients start bleeding, and that becomes a very big trauma for the patient. And these patients, with the advent of alternative medicine, and classically these bleedings, they stop on their own. So these are the patients, because in India it is seen that alternative medicine, everything is safe. It is natural. So they keep doing that. They stop on their own. So I tell them that even if you hadn't taken any medicine, the symptom would go away. The disease is still there. So there's a difference between a symptom and a disease. A symptom is what you see on the outside. So like you say, a lot of patients say, my mother had gallbladder cancer, but we came to know in last stage. So that cancer was going on for 5 years. There was no symptom.
Right.
When the symptom came, it had already was all over the body. It has metastasized, as they call it. Right? So as gastroenterologists, we were taught by our teachers that you have to investigate. You are not supposed to miss any diagnosis. So we don't want our patients to have blood and then ignore it and then harbor a big illness.
Correct.
So straining, so with constipation, these 3-4 things become very important. So the 3 proper ways I ask my patients to clean their gut, the 3 natural ways to clean their gut, 25 to 40 grams of fiber, mixture of soluble and insoluble, 25 to 30 grams for a female, 30 to 40 grams for a male, right? Move your body. If you cannot do anything else, 10,000 steps of brisk walking, everyone can do even at work. Otherwise, the classical recommendation is a mixture of an aerobic
And the strength training.
and a strength training. Aerobic comes with brisk walking, jogging, cycling, running. Strength training comes, you can do it naturally at home. I ask them to do push-ups. 10 push-ups, 3 sets.
Correct.
10 sets, 3 sets of 10 squats, 3 sets of 3 sit-ups. If you do it 3 times a week and 2 times brisk walk, that is good enough. So 150 minutes to 240 minutes is the recommendation. And third, at least 3 liters of water. And if you're non-diabetic, you can have 1 coconut water daily. Because this is important because the fiber will pull water. And if you are dehydrated, then again you'll have bloating, constipation, gas with all the fiber intake.
Correct.
So all this has to be told to them very clearly. And I think with these 3 problems with constipation and 3 natural ways to clear the gut becomes a very important thing to counsel our patients.
Two things that came to my mind. One is, I add psyllium husk to my patients pretty much all the time.
Okay.
There is multiple brands that is available in the US. What is there is a thing called isabgol husk over here, right? Is that your common practice?
I definitely ask patients to take it if they are comfortable with it and want to take it. But I again, see, as a gastroenterologist, I have to tell the positives and the negatives. Psyllium husk is a very, very, very good thing. It is a soluble fiber. So your 60 to 70% soluble fiber, much more than your chia seeds, which are again a very popular superfood, if you can call it, in India and in the West. So much more than that. Second, isabgol is a soluble fiber, so it is going into your gut and becoming a soluble gel matrix. Now this matrix, one, will give you satiety, so it will prevent overeating. Second, it will slow your gastric emptying, so it will slow the sugar absorption from your gut, so the post-meal sugar spike would be better. And third, it will bind your bile acids in your gut and it will prevent the LDL cholesterol from going high. So there are studies with soluble fiber, all kinds, that when you use them, the binding of bile acids reduces the LDL levels. So your liver has to remove the LDL from the blood. So there is significant reduction in LDL, which is the bad cholesterol.
Right.
So these 3 are the very important, genuine benefits of isabgol or psyllium husk. But along with this, you have to understand, if you are dehydrated, it needs water to form that gel.
Correct.
So again, it will cause bloating, maybe vomiting, upper abdominal pain.
Cramps as well.
Yeah. Second, if you are a diabetic patient and you have a condition called small intestinal bacterial overgrowth, so your anaerobes are in the small intestine, it will cause fermentation in the small intestine. And third, because it is a soluble fiber and it is going to make a gel, so if you're on important medicines like BP lowering medicines, like diabetic medicines, like blood thinners, you have to space out at least 2 to 3 hours from isabgol because its absorption will be reduced and your blood parameters and all these things, the drugs won't be able to act. So these 3 things you have to keep in mind with the positive effects.